Hi doctors, I want to show you a case that has posterior open bite written all over it. So if we look to the left on the initial setup for this case, deep bite, lower crowding, so some IPR planned in, no molar movement, so at least we know we're not going to get a posterior open bite from expanding the molars. However, there are not bite ramps, and so there is a good possibility that the patient will have the opportunity to intrude the molars away from each other just from wearing the aligners throughout treatment. And the other possible reason for posterior open bite is the very, very tight overjet planned at the end. There is almost no room planned between these upper and lower anterior teeth, and we can see by the superimposition tool that the lower teeth are intruding. They are intruding and moving buccal. So the buccal movement's very easy to do. That is very likely for those teeth to follow along with the aligner to go buccal. But the intrusion movement is one that is easy to do with the right attachments. So it would be more advantageous to have more retention attachments here. But even with more retention attachments, the aligners may not, or the teeth may not follow along the aligners for 100% of that intrusion. So if they move buccal, but they don't move down enough, then these teeth are going to finish with a heavy anterior interference, therefore a posterior open bite. And if you have the combination of an anterior interference plus then no bite ramps, and the teeth are able to intrude away from each other, then that is going to be a very big posterior open bite. So the key things here that I have added are bite ramps on the upper centrals. I'm keeping them on the centrals because that should be effective enough to disocclude the posterior during treatment, and keep them off of the lateral that is rotating. I also increased the amount of IPR so that we can finish with a little bit more of an overjet, leaving us with some wiggle room if and when those anterior teeth do not completely intrude. And this is not a fault with Invisalign. It's just that the intrusion movement is the one that the body is going to resist the most. So we just need to plan accordingly so we don't finish with a problem. This is going to be very predictable and efficient in 16 aligners.